Hi. Well, this is an update on my CMC joint surgery on my left hand. And I just wanted to give you kind of some updates as far as, last time I had my ACE bandage and a hard splint on, and I got that off on, I can't remember the date, but it's been about a week. Maybe 2 weeks now. No, a week. So this is my third week after surgery. And I got this at 2 weeks, on the 3rd of July. And today is the 12th, I believe, or the 11th. That's the 11th of July, 2023. And I went in and I got this off, and I told him the ACE bandage and the hard splint. I got my stitches out, and I told them this is, for me, this has been an easy surgery so far as pain. My max pain level has probably been maybe a 5 since surgery and right after surgery. So it's pretty comparable. Probably before my surgery, it was a little bit more pain off and on. But this surgery for me has been easy as far as pain goes. My shoulder surgeries, I've had about 3 shoulder surgeries on my right and 1 on my left, and I've had some elbow surgeries. So shoulder surgery is no joke. That is painful, and that's what I was comparing this to. I still have a long recovery probably for everything to be working okay, and maybe when I get into physical therapy on the 24th, which is about a week or so away, maybe moving my thumb and everything will cause a little more discomfort, but I try to move it inside of here just so that it does get some movement, and I'm able to squeeze and everything my fingers that are exposed. I did get the stitches out. I had my knuckle nodes are removed because they had osteoarthritis in them, and then I had a pen put in right here, so I can't move this joint. And this finger is still pretty swollen, and you can see inside where they did the trigger finger release. And that's the only part that I can see right now. I have some stitches I had stitches inside of here where they did the joint and the tendon roll removal, and then I had a tendon released here. It was down in my arm, and so I had about 6 or 7 stitches locations on my left hand. And I can't reach, obviously, the other ones, but I've been putting a scar treatment on it. So up here, the skin is just peeling off. It's crazy how my skin is just peeling. I feel like I'm a chameleon or something. Or not a chameleon, but a lizard or something, snake. But I'm using this Cote scar treatment, scar gel, and it's for surgeries and burns and cuts and injuries, C-sections, cosmetic procedures, and trauma. And it's a silky smooth, non-greasy, odorless, and suitable for sensitive skins. And you can use it on new scars or old scars, it says. And it's supposed to flatten your scars out. And it's just a little tube. It comes out clear. It's silicone. And I just put a dab of it on my scar or my finger right here. And then I just massage it in and cover it. And I do that about twice a day. And I reach in and try to do this scar in here, but it's still I don't know, it's still pretty hard. And so maybe when I get my cast off, I'll have a little more access to it. But the other thing I wanted to mention is in my previous videos, I've mentioned how I really believe that the constant icing on and off, 20 on, 30 off, really made a difference. And I mentioned a neck, soft neck gel ice pack thing that I had used for my neck surgeries, because I've had cervical and lumbar surgery as well. I know, I'm a surgery queen, right? I've had so many surgeries and they're not even cosmetic. So anyways, I got this when I was having neck surgery, and this has been a lifesaver for so many reasons and so many times. I can put it around my neck and it feels great. I could put it on my shoulder when I had my shoulder surgery. And what I did was I wrapped this around my arm like this, so the exposed arm above the cast, I left it on there for 20 minutes. And you could also put it on your fingers. There's nothing wrong with that, and doing that as well. But even though you can't reach the hand, this will penetrate down your arm, and it helps reduce inflammation and it reduces pain. And I say, in my doctors, for my neck surgery and back surgery, they said you go to ice first and then you get the pain medication. And I took pain medication long before I ever felt the pain. So I stayed on a regimen of pain medication about every 4 to 6 hours, even before the block came off, because the one thing that I know from my previous surgeries is that as soon as you feel like, oh, I don't feel anything, so I'm not going to take any pain meds, then eventually that pain shows up. And it usually shows up pretty bad. And you have already gotten behind on that pain schedule, which helped to mitigate that pain and minimize, sorry, trucks are going by. Sorry, those were buses and garbage trucks and then my dog. So the ice helps to mitigate the pain. And when you take the, and you stay on that icing regimen, then pain meds help to also reduce inflammation as well. And it keeps you managing that pain long before it ever shows up. And I was on my narcotic pain medicine until I had my surgery on a Tuesday, and by Friday, Saturday, I was done with pain meds. I didn't need them anymore. And occasionally I would take an ibuprofen or a Tylenol, but for the most part, I just iced. And I still do that. Even to this day, for any pain that comes on, I first seek the ice, and then if that still isn't working, then I go to, hey, okay, people walking by. The joys of doing it outside, but it's such a beautiful day that I thought that I would do it outside. So I still ice whenever I need, I feel pain coming on. And then I might, if I need to, take a Tylenol or something. And that's what I did in this recovery process. So what kind of icing wrap did I get? This is, and I don't know if they're still in business, but I believe they probably are. This is Elasto Gel, and it's www.elastogel.com. And this has served me and my family very well. I've had it probably 10 years or more. and it still works great. You put it in a plastic bag, always in a plastic bag, into the freezer, and it's ready to go. And it never gets hard. It's always soft. And it has a covering on it, so you don't need to put an extra towel or anything. But it's very soft and pliable, so it works on anything. Maybe you've had knee surgery, or maybe your knee is bothering you, or maybe your back is bothering you. It really works well for many different areas just because of how pliable it is. Now, the other thing that I've gotten, and since I got the Ace Band-Aid off, I got these before I got the Band-Aid, when I had the splint on, and then the Ace Band-Aid wrapping around it. You've probably seen me already with it. These are gardening or UV protection sleeves. Right? You get them in the gardening. I got it on Amazon. I got about 12 pairs, all different colors. But the Ace Band-Aid was falling off and not falling off, but unraveling every time I took a shower and I put that cast cover on, shower cover on. The thumb was unraveling, the finger, it was just a mess. And I had to leave it on there. I mean, it was dirty. It was driving me nuts. So I got a package of these, and I slipped it on over the Ace Band-Aid. And then when I got my hard cast, I just decided to put it on here as well to keep it clean. But then I found out that this casting material is really rough. So every time I would put on my jacket or a hoodie or a t-shirt or whatever, it was always getting kind of stuck, hung up on this. So to help alleviate that, I just got these colorful wraps, and now everything just slips right on. Really, well, my video cut off. I'm not sure why, but anyways, I just slipped this. Maybe I hit the pen, turned it on. I just slipped this on, and everything slips right over it, and it makes it really easy, and it's kept the cast clean. So I don't have my cast cover for the shower, but you can just look up shower cast covers or something like that on Amazon, and I just slip it on, and it's got a boot like suction thing up here, and then it's all clear, and then there's a thing for your hand. It's big. I just got the short because I didn't need it to come up to my armpit, so I can put it here, I can put it down below, but it's clear, and I use that and wash my hair and wash my body, and doesn't, get this wet or anything. So that's kind of my update for my 3 weeks. I guess it's 3 weeks from recovery, or 3 weeks into recovery from surgery. June 20th was my surgery. Today is July 11th, and it's been a really pretty easy. Now again, I also have to say I didn't have any pins put in the thumb at all, and I guess that makes a difference. And what I would say for that is to really ice. Just keep icing all the time. I mean, anytime you have pain, always try to ice, and if you can ice before you get into that pain cycle, it's always better. But just know that your surgery may be different than mine, and your experience may be different than mine, and I am not a professional, a doctor, or anything like that, but these are the things that worked for me. And since I've had multiple surgeries, most especially my shoulder and my my spinal surgeries, those are very painful and excruciatingly painful. And the ice really, really helped. And it helps with your recovery. It helps with how soon you can get going. Walking is always good, no matter if you're having any kind of surgery. Getting up and moving is really important, because then you're not letting things get stagnant in your body, and you have a greater chance of clots if you do just sit around. So getting up and walking, I try to go walk for about 10 or 15 minutes. If I can do 30 minutes, then I do that. It just depends on my schedule and my dog. He's not always amiable for walking that far for that long. He's old. So those are some of my tips. I'm doing really well. I hope you will do very well as well. I hope these tips have helped, and maybe get some of the items that I've suggested. None of these are products that are being sponsored or anything like that. They're just things that I personally use that have helped me, and what other people have recommended along the way and what's helped them. Okay, well, this is Marty, and I'm chasing adventures, and I hope you will too. And like and subscribe if you like this video. I'm going to try to keep doing some more, and maybe they will have some meaning or help for you. Have a wonderful day. It's a great day here in the Pacific Northwest, and I will see you again.